The best cancer centers pursue cutting-edge science and treatments and provide compassionate, patient-centered care. A National Cancer Institute designated comprehensive cancer center for over 40 years, Yale Cancer Center and Yale Cancer Hospital at Yale New Haven combine innovative cancer treatment and quality care to the patients it serves. Director of the Cancer Center, Dr. Thomas J. Lynch, Jr., emphasized the focus of current research with the OncLive News Network.
We've worked hard to bring in investigators from around the country to build a cancer research care and research program that's focused on molecular oncology, clinical trials, and advancing immunotherapy.
In particular, the Lung Cancer Master Trial Protocol and Stand Up to Cancer Melanoma Dream Team Trial, as well as ongoing studies in gliomas, a type of brain cancer, firmly positions the Yale Cancer Center as a top research center in the country.
Basically, what the last Master Protocol does is it takes patients with squamous lung cancer who have failed one prior chemotherapy and then genomically profiles their tumor DNA. And from that result, we are able to ascertain what are the genetic abnormalities, if any, in that tumor, and then based on that, assort the patient to one of multiple arms of therapy, each therapy being randomized against a control, in that case being docetaxel. So we're studying drugs that target the PI3 kinase pathway, FGF fibroblast growth factor receptor, as well as CDK4/6 cell cycle, to name a few.
The Stand Up to Cancer Melanoma Dream Team trial establishes a collaborative, scientifically rigorous, multidisciplinary program that brings together the two highly promising treatment approaches of targeted therapy and immunotherapy.
The Melanoma Dream Team trial is a trial that looks at personalized medicine approach to treating a specific subset of melanoma, which are the non-V600E melanoma subtypes. These are the subtypes that have currently FDA-approved drugs specifically for that indication. Our patient population in the Melanoma Dream Team trial would have been patients that had already have failed immunotherapy and now need some additional type of treatment. Currently, the standard of care for those patients that have progressed on immunotherapy would be some type of chemo or other treatments, as there are no targeted therapies yet FDA approved for that subset of patients. Our trial is looking at those patients who have failed immunotherapy, for which there is no FDA approved targeted therapy, and looking to see whether or not a personalized medicine approach, whereby we look at the tumors and extensively profile them with genotyping and choose a treatment based on that genotyping, is better than standard of care treatment.
Dr. Murat Gunel's work in genomic research has revealed the genetic risks for brain aneurysms, the mutational landscape of brain tumors, and a multitude of genes fundamental in cortical development.
As I mentioned, especially with the trials that are ongoing with the checkpoint inhibitors with immunotherapies, which are active immunotherapies, we're very hopeful that we will be able to not only hit the most aggressive clone with a targeted treatment, but also will be able to globally cover these cancers. What I'm, however, particularly excited about is the fact that unfortunately, one of the side effects of alkylating agents such as Timodar that we use with glioblastoma is a hypermutated phenotype where the alkylating agents cause mutations in the DNA repair enzymes, and suddenly you see this increased number of somatic mutations per cancer. Just for example, average glioblastoma would have 100 or less somatic mutations per cancer, whereas the treatment can lead to what we call as a hypermutated phenotype, where that glioblastoma, instead of having hundreds, for example, protein-altering mutations, now have thousands. The question is that hypermutated phenotype with all these different now foreign antigens can actually help the immune system fight the cancer.
But conducting world-renowned research can only go so far. Ultimately, that research should be translated into real-world patient care. With a burgeoning survivorship and palliative care program, Yale Cancer Center and Yale Cancer Hospital at Yale New Haven meet the needs of patients throughout the care continuum.
I think the needs of survivors evolve over time. I think directly after treatment, there is a high need for information, reassurance, and coping with fears, distress, and addressing these healthy lifestyle behaviors that patients are ready to make. That we're still here for them, even though they might not be seen every day in radiation anymore or weekly in chemotherapy anymore, that we know that they're out there and we want to help them help themselves going forward.
The importance of palliative care is expanding. It's now an essential part of the care regimen.
So in the past, we used to think about palliative care just as hospice care at the very end of life. But now we think about integrating palliative care services throughout the course of a disease. And it's the stage of disease that dictates the range and intensity of palliative care intervention. Palliative care is all about taking a patient where they are and helping them to live the best possible day they have today. And by doing that, it's by clear communication about their goals, about their hopes and their fears, by giving them a chance to talk about difficult emotions, and then by making sure that they are physically comfortable, again, to have the best possible day they can have today.
What a cancer patient wants to know are two things. One is that you're going to do everything you can to prolong their survival, and you're going to do everything you can to give them the best chance of cure. And the second thing is they want to do things that they want to participate in research that's going to give them a chance of doing better. And patients are highly invested in doing better than our current treatment is for cancer. And I think when you get that kind of alignment between investigators who have a passion for moving the field forward and patients who desperately want to see progress, maybe not just for themselves, but also for the future. And I've been struck by how incredibly generous patients are about thinking about how clinical trial participation not just helps them, but could help future patients